Should you enroll in a Medicare Part D prescription drug plan if you do not take any medications? Absolutely, yes, get that Medicare Part D plan. Let me explain. So today I'm talking to a couple in Florida. They're 76 years old and 73 years old. And 3 years ago, they decided to dump their Part D plan. They did this because they were on barely any medications. They happened to have IRMA where they pay more money for it because of their higher income. And they just did not see the value in paying that money. But now, fast forward 3 years, and she has a diagnosis where she needs very expensive medications. It's going to cost her over $1,000 a month between the two medicines. She cannot jump into a Part D plan mid-year. And not only that, so she's going to have to wait till January 1st of 2026 to get the coverage. But she also has to now deal with penalties for the 3 years that she did not take Part D. The problem with the penalty is for every 1 month that she did not have the drug plan, there's a 1% penalty based on the national average premium. So let's say it's $3 a month and you stack it. So you take that penalty, you multiply it times 36 months, and that is a penalty that is going to stay with her forever. So I share this story because in their mind, when they made the decision to get rid of the plan, it made perfect sense. But now there is this issue. The rest of this year, they have to spend all that money. Then they're going to have to deal with IRMA now and penalties and the cost of the medications. So think wisely when you're weighing this because you may need that coverage in the future and then it's going to cost you a lot more had you just stayed in it and paid a little bit as you went.